Hello everyone, so let me just check, am I audible, is the screen clear so that we can start this session? Okay, so this is the session of most important thorax MCQs which should be revised before the examination for your NEET PG target of 2022. So let's start with the session. Meanwhile the students are joining and let me just have a check, everything is all right. Okay, so yes, I am audible and everything is correct. So let's start with the session. Before starting the session, I would like to tell you about myself. Myself, Dr. Monalisa, anatomy educator on the Unacademy platform, and I have been teaching for the past 9 years. And let's talk about the special class features, the free platform of Unacademy. So for attending the sessions on the free platform of Unacademy, you have to download the Unacademy app and thereafter you have to find your goal. So पहले क्या करना है? You have to find, the first thing which you have to do is to find your goal, that is NEET PG. Okay, thereafter via the link provided of the free session you can be present for the free sessions of Unacademy platform. So I will also give you all the details when the free session is going to be held, and also for the entire month of January the details will be discussed with you, don't worry about that. So what you can do, you can attend the session of the special free platform, which is an interactive session. The learners and the educators interact among themselves. Polls are conducted among the learners. You can participate in the poll, you can raise your hand, get your doubts clear, write itself in the session. Never ever miss a session. What does that mean? Sorry. That means once you start seeing the session, you can follow the educator on the Unacademy platform, and thereafter you will get notification regarding all the sessions taken by that educator. So you are not going to miss any of the session. So after completion of the session, you will be also provided with the PDF notes. Okay, so PDF notes will be downloaded and you can revise all the contents via this notes anytime, anywhere. Read from the top educators of Unacademy platform. The students watching the session for the first time, they have to use the code ANAT10 as an unlock code to be present for the live sessions. Now, I would also like to give the information firstly about my free session which is going to held tomorrow. Okay, so sorry. So yes, I am going to tell you about the important session which is going to be held. So I will just modify it. It's exactly on 26th of January. So please note down, it is 26th. So the session is on 26th of January. And the sessions will be afternoon session, 1 p.m. and 2 p.m. will be the timing. So 1 p.m. and 2 p.m. will be the timing, and these are afternoon sessions which is going to be held. So do present for this session. So 26th January. So actually this was the session which I thought I will take previously, but now I am going to take these sessions tomorrow. So exactly 26th January afternoon, 2 special sessions are there. So do present for this session. Okay. So yes, so you can also give me whether you are free for this session or not, so that I can modify the timing also. Now the free test which is going to happen, let me show you the free test calendar on the on this platform. So this is whole details of the free test which is going to be taking place on the Unacademy platform. So free test calendar has been discussed with you. So you can have the whole scenario of the test and the whole details and the timetables has been discussed here. You can pause it, you can read this, you can know which test you want to appear. I will tell, if you are going to appear for NEET PG examination, 22 sessions. So do attend all these sessions. This will be highly beneficial because these sessions are made by the top educators of Unacademy platform. Get enrolled for this test using the code ANAT10. Okay, now let me tell you about the plus platform. जब मैं plus platform की बात कर रही हूँ, when I am talking about the plus platform, it's the session where you can access both live and recorded version of all 19 subjects. They are completed in a very systematic way. They are taken by the top educators of Unacademy platform, compete in live tests and quizzes, study on the device of your choice. So you can study on the device of your choice. You can access more than 25,000 MCQs of all 19 subjects, clinical MCQs, high yield MCQs, which is targeted for the current examination pattern. So sorry. So this will be highly beneficial for you. So other important point is that each of these clinical MCQs will be provided with a explanation, detailed explanation given by the top educators of Unacademy platform. And soon you are being provided with the printed notes of Unacademy if you are going to take the subscription 1 year or more. Let's talk about iconic subscription, where you get the benefits of 2 platforms. Unacademy Plus and that of the Prep Ladder. So that means you will get the benefits of the Plus course of Unacademy, along with you will get the benefits of Prep Ladder, live recorded versions, video lectures, QBank 3, system rapid revision, snapshots, treasure, dream notes, all will be provided to you. Okay, so and I would also like to show you the slide, which is where the details of Plus and Iconic pricing detail has been compared. So you can have a comparison of these details. You can use my code for an extra discount of 10%. Now, I would like to congratulate the toppers. Okay, I would like to congratulate the FMG December 2021 toppers. I'm very glad for them, and they are going to I am giving them all the best so that they can crack the NEET PG exam in the first attempt. Okay, I would also like to share this information of highly updated effective QBank on the Plus platform of Unacademy. Grab this opportunity. 25,000 and more high yield clinical MCQs based on latest pattern of exam includes a detailed explanation. So use this code for extra 10% discount. Now, my dear aspirants, I would like to share this information with you. Republic Day special, 6-month free extension. This is a great offer which is going to on 25th. Today is 25th Jan, so it is applicable on 25th Jan, 26th and 27th. So if you are going to take 1 year of subscription and more, 6 months of the free subscription you will be provided with the extension of 6-month free subscription. That is a great opportunity for all of you to take the Plus subscription. Use my code NAD10 to get an extra discount of 10%. So all of you, please grab this opportunity if you are planning to take the subscription. Now, you must be wanting to know which are the batches which is right now going on the platform. The batches which is right now going on the platform is Focus FMG 22 Comprehensive Batch, Target NEET PG 22 MCQ Batch. So these two batch is right now going on the platform. So just grab this opportunity and take the subscription. Use my code NAD10 and get an extra discount of 10%. Let's start with the MCQ session now. So let's start with the most important MCQs targeted for the NEET PG 2022 examination. So my dear aspirants, those who have joined, let's start with it. Tendon of Tordado. Okay, so tendon of Tordado is a valve in the opening of inferior vena cava, a ridge which is connecting inferior vena cava and superior vena cava, connects coronary sinus to tricuspid valve annulus and is an interarterial ridge. So according to you, which is the correct one? Tendon of Tordado, which is the correct one? Please mark the correct answer, my dear aspirants. A, B, C, D. Which is the correct answer? Your time starts now. You can give the answer as A, B, C or D in the message. Okay, I got an answer from Pal. Pal is telling it's B. What about others? So just go for it. If you are knowing it or not knowing it, just attempt it because I am there to explain, don't worry. Tendon of Tordado, what is it? Okay. So, if I want to take a correct answer, I will go with C as the correct answer. Actually, it is a subendocardial, it's a collagenous subendocardial tissue which is originating from the central fibrous body, and it is connected to the Eustachian valve of coronary sinus. Okay, so what is the best answer will be, it is connecting coronary sinus to that of tricuspid valve annulus. Okay, okay, my dear aspirants, so see here I want to show you that this is tendon of Tordado. So let me just, okay, I would also like to write the answer here and then I will move up with the explanation. So firstly, write down what is tendon of Tordado. All of you, it is very important, has been asked in the previous year examination. Okay, in the previous year of examination, this is previous year MCQs. So please write down the definition of tendon of Tordado. It is a collagenous subendocardial tissue. It is a collagenous subendocardial tissue which originates from central fibrous body and ends in Eustachian valve of coronary sinus. Okay, so this is exactly the definition. This is exactly the definition of tendon of Tordado. So here, if I use a blue color for it, so see here, I am highlighting the tendon of Tordado. See here. So this is tendon of Tordado, which is starting. If we talk about the starting point, it is starting from this opening. This opening is opening of coronary sinus. So it is extending from the opening of coronary sinus, and then it is going towards the it is superiorly, actually it is also forming superior boundary for triangle of Koch. It is originating from central fibrous body and ending into forming a connection with the coronary sinus. Okay, so we will go with C as the correct answer. Here you can see superiorly, अगर मैं बात करूँ triangle of Koch की boundary की, so superiorly it is bounded by tendon of Tordado, anteriorly it is bounded by septal leaflet of tricuspid valve. So this tricuspid valve is forming its anterior boundary, tendon of Tordado is forming its superior boundary, or postero-inferiorly it is having an opening of coronary sinus. So coronary sinus opening, which has been shown here, is forming postero-inferior boundary. Can you tell me what is the importance of tendon of Tordado? What is the importance here? Anyone? The importance of the importance of triangle of Koch, which I am explaining along with its border, is that it is the location of AV node. So triangle of Koch is a very important anatomical region seen in the interior of right atrium, where we have got the location of AV node. So yes, so the correct answer is, it is connecting the coronary sinus to tricuspid valve annulus, which is quite clear by seeing this diagram. Is it okay? So my dear aspirants, let's move on to the next MCQ. All the best to everyone. Question number 2. All of the following arteries are common site of occlusion by the thrombus except. So options are, so A is anterior interventricular artery, posterior interventricular artery, circumflex artery, or marginal artery. So which is the most common site of occlusion by a thrombus formation? A, B, C, D. 4 options are there, my dear aspirants. Please mark the correct answer. Your time starts now. Your time starts now. A, B, C, D. All of the following arteries are common site of occlusion formed by the thrombus except. Okay, so I am just waiting for your answer. Please mark the correct answer, my dear aspirants. Okay, so I will just wait for 30 seconds. For every MCQ, I will just wait for 30 seconds. So if I get an answer, is it okay? I will otherwise proceed. So all of the following, so we have to, this is an artery, this is a question which is particularly asking about the thrombus formation is most commonly seen in which of the following arteries. So if I will have to mark the correct, I will go with anterior interventricular artery, A as the correct answer. So I got an answer, okay. So see here, don't worry, I will give you Tejashree, I will give you the explanation. So can anybody tell me anterior interventricular artery, what is the other name of anterior interventricular artery? What is the other name of anterior interventricular artery? What is the other name of anterior interventricular artery? It is also called as LAD artery. It is also called as LAD artery. Okay. So when we talk about the thrombus formation, most common, we go sequence wise. So the most common artery to be involved in case of thrombus formation is LAD artery. So in case of LAD artery, 50% is the chance of thrombus formation. So thrombus formation frequency, I am talking about the frequency of thrombus formation. The most commonly it is involving the LAD artery. Next is the right coronary artery. RCA means right coronary artery is involved in case of 30% of the cases. And if I go for left circumflex artery, which is a branch of left coronary artery, 15% is the involvement. So see here, this is the sequence or the frequency of involvement, and by this we can clearly say that most commonly the artery to be involved for the formation of thrombus is, the correct answer will be anterior interventricular artery, which is also called as LAD artery. So we have got A as the correct option. Okay, my dear aspirants, let me show you this diagram. You can see here the LAD artery is also called as left anterior descending artery, which is a branch from left coronary artery, left circumflex artery, and the right coronary artery. So arteries which are in the box are the common site of formation of thrombus. Left coronary artery, which 2 branches are involved. One is left circumflex artery in case of 15% cases, left anterior descending or anterior interventricular artery in case of 50% of the cases, and right coronary artery is involved in case of 30% of the cases. So let me write the frequency also. Left circumflex is involved in 15% cases, 50% cases में LAD artery involved होता है, right coronary artery is involved in 30% cases of thrombus formation, and this will lead to heart attack, myocardial infarction. Okay, my dear aspirants, so let's move on to the third MCQ. All the best for the third MCQ. So this is showing you the frequency of thrombus formation in the following arteries. Now let's talk about question number 3. All opens into coronary sinus except middle cardiac vein, small cardiac vein, anterior cardiac vein and great cardiac vein. So according to you, which is the correct answer? All of the following veins opens into coronary sinus except. Which is the correct answer, my dear aspirants? Please mark the correct answer. So yes, waiting for your answers. So if I have to mark the correct answer, the vein which is directly opening into coronary sinus means the vein which is not opening. Here the word except has been. So it's the correct answer is C, anterior cardiac vein. So anterior cardiac is the vein which is not opening directly. Anterior cardiac vein is the right answer. So yes, why? Because it is opening directly. It is opening directly into right atrium. So actually when we are talking about the other venous, if we talk about the venous drainage of the heart, middle cardiac vein, small cardiac vein, great cardiac vein, marginal vein, left ventricular vein, means all the veins of the heart is draining into coronary sinus, and then the coronary sinus opening is inside the right atrium. But when we see the anterior cardiac vein, it is directly opening into the right atrium. So several diagrams I will show to you which will clear your doubts. So let's proceed with that. So first thing is, this is the posterior view. What you are seeing is the posterior view of the heart. Okay, so when you see the posterior view of the heart, so let me slightly enlarge it, my dear aspirants. Okay, so is it okay? Yeah, see here. So you can see this structure which is shown is the coronary sinus. Coronary sinus. This is the coronary sinus and it opens inside the right atrium, and many veins are draining into it. The posterior vein of left ventricle, small cardiac vein, the left marginal vein, the great cardiac vein, the oblique vein of left atrium. So all these veins which I have highlighted here is directly opening into coronary sinus, and coronary sinus is opening inside the right atrium. Let me show you another diagram where I can show you the interior of the heart, and you can just see I am highlighting this image where you can see the interior of right atrial chamber. Right atrial chamber. So when we are seeing the interior of right atrial chamber, you can clearly see the opening of coronary sinus. What you can appreciate here, the opening of coronary sinus is inside the right atrial chamber. This is the opening. This is exactly the opening of the coronary sinus inside the right atrial chamber. Okay, so a cut has been, in a straight cut or a vertical cut is along the line connecting superior vena cava, inferior vena cava, opening of the right atrium, and then the flap is retracted. When the flap is retracted, the interior of the right atrial chamber is seen and the opening of coronary sinus is highlighted. So it is clear. Now, so in another diagram where you can absolutely see that this coronary sinus and the veins draining is great cardiac vein, middle cardiac vein, small cardiac vein, and see here the anterior cardiac vein. So anterior cardiac vein, if you will see, it is opening directly into right atrial chamber, but the other veins are draining into coronary sinus, and then the coronary sinus is opening into right atrial chamber. So this diagram is clear. This is the anterior cardiac vein which you are seeing. This anterior cardiac vein is directly opening. These are the openings. This is directly opening into the right atrial chamber. This is superior vena cava, so this is the right atrial chamber, and coronary sinus is also opening into the right atrial chamber, and in this the other veins are draining, small cardiac vein, middle cardiac vein and the great cardiac vein. So I think with this diagram the concept is clear. Is it okay everyone? Please give me a thumbs up if is it okay. Then we will move on with the next MCQ, that is MCQ number 4. Okay. So yeah, the next MCQ is, let's talk about the next MCQ. Rasmussen aneurysm involves bronchial artery, pulmonary artery, intercostal artery or the aorta. What is the correct answer? Rasmussen aneurysm involves bronchial artery, pulmonary artery, intercostal artery or the aorta. So according to you, which is the correct answer? Your time begins now. Mark the correct answer, my dear aspirants. So my dear aspirants, if we talk about the aneurysm, Rasmussen aneurysm, actually it is involving pulmonary artery. So the correct answer is pulmonary. Yes, absolutely right, son. Tejasri, absolutely right. You are absolutely right. Pulmonary artery is absolutely correct answer. So it is involving pulmonary artery. So yes, Tejasri is absolutely right. So pulmonary artery is absolutely correct answer. Actually, the case where it is involved, so it is seen in the case of tuberculosis, and if the pulmonary artery is involved, sometimes the aneurysm is such enlarged, it will rupture and will lead to hemorrhage. Okay, so it can lead to hemorrhages in this condition, and caseous necrosis has been seen in this condition, and pulmonary artery is involved. So let's talk about the next MCQ, that is question number 5. A bedridden patient is on liquid diet and develops aspiration pneumonia. Which of the following bronchopulmonary segment is most likely affected? So options are posterior of the right upper lobe, inferior lingular of the left upper lobe, apical of the right lower lobe, or that of the posterior of the right lower lobe. So first thing is that what is the position of the patient, which is the key point to mark the correct answer. The patient is bedridden, यानी patient किस position में है? Supine position में. That means the patient is in supine position. Okay. So and we have to know अभी जो aspiration pneumonia में where which of the bronchopulmonary segment is most likely to be involved. So we have to go with the correct answer. If I have to mark the correct answer, I will go with the apical part of the right lower lobe. So 3C is the correct answer. 3C is the correct answer. Okay, so actually posterior of the right upper lobe is also correct, Tejasri. It's also correct along according to the Harrison. But if we have to pick one, we will go with C as the most correct answer. अगर हमें one answer pick करना है तो we will go with C as the most correct answer. Otherwise, you are also right that in the books of Harrison of medicine book, posterior of the right upper lobe is involved in that case also. So let me give the correct explanation for this. Actually, अगर हम बात करेंगे aspiration to be accommodated in which bronchopulmonary segment, that will be differing if the person is in supine, bedridden, or the person posture is erect. So that will be different. So I will like to give you the explanation here. So let me just write the whole details so that you can revise before your examination. So yes, okay, aspiration in supine position. Supine means in this also the supine position क्यों है? Because the person is the patient is bedridden. Supine posture position most commonly, if we talk about most commonly involvement of bronchopulmonary segment, so most commonly it involves, if we talk about most common involvement, it will involve the right lower lobar bronchus. Okay, right lower lobar bronchus. Actually, it will be occurring in the apical. You can say the bronchopulmonary segment which is involved is apical, which is also called as superior apical or the superior bronchopulmonary segment of right lower lobe. So please mark it, right lower lobe. This is very important for your MCQ, that in case of aspiration in the supine position, MCQ के लिए बहुत important है, which is the most commonly involved bronchopulmonary segment. This is the apical bronchopulmonary segment of right lower lobe. So we have gone with this as the correct answer. So okay, so this is the reason we have chosen here the C as the correct. We have chosen C as the correct answer. Now according to the other option, which is also right according to the book of Harrison, that posterior bronchopulmonary segment of right upper lobe, according to the Harrison medicine book, it can be also, this is also important for MCQ, अगर सिर्फ we have to choose one for it, so we have gone with this answer. So ठीक है, the second most important हम कह सकते, this is the most important, and the second most important bronchopulmonary segment to be involved is posterior bronchopulmonary segment of right upper lobe. So Tejasri, you were also right, but अभी हमारे पास apical bronchopulmonary segment of right lower lobe था, इसलिए हमने C option mark किया. Otherwise we have gone with A as the correct answer. Okay Tejasri, now What I told you, the bronchopulmonary segment being involved will be different if the position of the patient is erect or upright. So, in case of in erect and upright position, in erect and upright posture, that is the standing posture, that is that the patient is in a standing posture or the patient is sitting. So, in that case, the involvement of bronchopulmonary segment will be right lower lobe, posterior bronchopulmonary segment or the basal bronchopulmonary segment. So, right lower lobe, basal bronchopulmonary segment or the posterior bronchopulmonary segment, which is again important for your MCQ. So, the position of the patient is erect or in the upright position. So, all these points are the keywords which is asked in the previous year, and I want that before your examination of NEET PG 2022, do revise this site, which is very important of accumulation in case of aspiration pneumonia. So, is it okay? Tejashri, Pal, Tejashri, Pal, Lawson, is it clear? So, let us move on to the next MCQ, that is MCQ number 6. Okay, let us move on to 6 number MCQ. All of the following are characteristic features of bronchopulmonary segment except. Okay, great Tejashri. So, all of the following are characteristic features of bronchopulmonary segment except. It is surgically resectable, option A. It is named according to the segmental bronchus supply. It is drained by independent intrasegmental branch of pulmonary vein, C option, and D is it is the largest subdivision of a lobe. So, according to you, which is the best incorrect statement about bronchopulmonary segment? Which is the best incorrect statement about bronchopulmonary segment? So, question number 6, please mark the correct answer. So, today we have got 20 MCQs, my dear aspirants, 20 MCQs, and after completing this session, again I will take a session on future doctor Unacademy future doctor, वहाँ पे general anatomy के MCQs हम discuss करेंगे. So, दो session है back to back. So, that session is at 5 PM and this session will be taken another 45 minutes I think, and all we can cover up all the 20 MCQs today. Okay, so Tejashri has given C as the correct answer. What about others? Tejashri has already given her answer. So, yes. So, actually C is absolutely correct answer, dear. C is absolutely correct answer. Yes. So, if we have to choose one, we will go with C as the correct answer because this is the incorrect statement about bronchopulmonary segment. If we go with the definition of bronchopulmonary segment, the location of tributaries of the vein is not intrasegmental. It should not be intrasegmental, it should be intersegmental. It should be intersegmental. So, the correct word should be used here, should be intersegmental, not intrasegmental. Okay. So, यहाँ पे C option correct है because the location of the tributaries of veins should not be intrasegmental, inside bronchopulmonary segment. Bronchopulmonary segment is the wedge-shaped functional unit of structural and functional unit of the lung, which is having the apex and the basal part. Apex part is towards the hilum region of the lung, and it is having intrasegmental drainage by the branches of pulmonary artery, bronchial artery, bronchus and all. But the location of intrasegmental tributary of pulmonary vein is not intrasegmental, but it is intersegmental. So, vein का जो tributaries है, that will be intersegmental. So, Tejashri is absolutely right. Now, see here, the same thing you can appreciate by seeing this diagram. This is showing you the exact definition of bronchopulmonary segment. So, this is exactly the bronchopulmonary segments. Okay. So, see here, जब हम bronchopulmonary segment की बात करेंगे तो we have got a total of 10 bronchopulmonary segment each for right and the left lung, and in this bronchopulmonary segment we have got a tributary of the vein which is lying intersegmental. Other than the structures lying segmental is a branch of pulmonary artery, bronchus and the branch of bronchial arteries. Okay, the same thing has been shown here. Here also you can see the correct location has been shown is the intersegmental course of pulmonary vein. So, see here, this is the pulmonary vein, which is not lying inside one bronchopulmonary segment. The location is exactly intersegmental. ठीक है? The location is exactly intersegmental. The location is exactly intersegmental. And this whole unit which you are seeing is one bronchopulmonary segment. This is one bronchopulmonary segment. This is the other bronchopulmonary segment. So I think this is clear to everyone. This is one bronchopulmonary segment. This is the other bronchopulmonary segment having the branch from pulmonary artery, bronchus and the bronchial artery. Got it everyone? Is it clear? Now let's move on to the seventh one. Okay, question number 7. Carina is situated at which level? Carina is situated at which level? Sorry. So please mark the correct answer. Your time begins now. Okay. So according to you, which is the correct answer? A, B, C or D? Carina is situated. This is a direct MCQ. You have to know what does the word carina signifies. Okay, my dear aspirant, please mark the correct answer. Okay, I got a correct answer from Tejashree. Absolutely right. T4 or the B option is absolutely correct. Absolutely right. So B option is absolutely correct, which is also T4. So actually this is bifurcation. What does this means? Carina means bifurcation of trachea. It means bifurcation of trachea, and bifurcation of the trachea in the principal bronchus, right and the left, is occurring at the level of T4. Okay, see here, this diagram will show you exactly that this level is called as the carina, and here the carina, you can clearly see the trachea. Here you can clearly see the trachea. This is the trachea having tracheal rings, and this is dividing into the principal bronchus, and these occurs at the level of T4. This is occurring at the level of T4, T4 and T5. So we will go with T4 as the correct answer. Absolutely right. Absolutely right. The location of cricoid cartilage, if you will see this diagram, you can see the location of cricoid cartilage. See here, this is the location of cricoid cartilage, and the location of cricoid cartilage is signifying at the level of C6 cervical vertebra. C6 cervical vertebra. So this is also important, has been asked in previous year, the location of cricoid cartilage. Let's move on to the next, that is question number 8. Let's move on to question number 8. The structure passing, which of the following structure is passing posterior to diaphragm? Oh, no. All the following structure is passing posterior to diaphragm except. So this is exactly asked in this MCQ, except. So you have to mark the correct answer, whether it is aorta, whether it is azygous vein, whether it is thoracic duct or greater splanchnic nerves. So your time starts now. Mark the correct answer. Question number 8. Structures passing posterior to diaphragm are all except. Structures passing posterior to diaphragm are all except. So we have got 4 options and you have to mark the correct answer. So yes, I am getting D as the correct answer. Okay, D. Okay, so my dear aspirant, you are absolutely right, Tejashree. D is absolutely correct answer. Greater splanchnic nerve. So actually greater splanchnic nerve is passing, if we talk about greater, lesser and least splanchnic nerve, they are passing through the respective cruras of the diaphragm. They are passing through respective cruras of the diaphragm. They are not passing through aortic opening. The aortic opening is lying posterior to the diaphragm, and through this 3 structures are passing, that is the azygous vein, thoracic duct and the aorta. So we will go with D as the correct answer. So D is the correct answer, my dear aspirants. So let me show you a schematic diagram of the openings of the diaphragm and the structures passing. Structures passing through the diaphragm is a favorite question for your anatomy MCQ. So just revise it quickly. See here. So see this diagram. If you want, I will slightly enlarge this diagram. So is it okay? So I have slightly enlarged it. Okay. So when I have slightly enlarged it, what you can appreciate here. So what you can appreciate here, the important opening. So what you can appreciate, the important opening. So when you are seeing the important opening, let's first talk about the opening, that is foramen of Morgagni, which is also called as space of Larrey. The foramen of Morgagni is also called as space of Larrey, and through it the structures passing is superior epigastric artery and the vein. And superior epigastric artery and vein is the branch of which artery? Internal thoracic artery. So this is through the space of Morgagni or the space or Larrey space. The second opening which I want to show you is the Vena Caval opening. The Vena Caval opening is lying at the level of T8, and the structures passing, it is lying at the level of T8, and the structures passing is, so it is exactly at the level of T8, and the structures passing is inferior vena cava and right phrenic nerve. When we are talking about esophageal opening or the esophageal hiatus, the level is exactly at the level of esophageal hiatus. The structures passing is so many structures. Esophagus pass through it, anterior posterior vagal trunk pass through it. Also the branches, esophageal branch of left gastric artery passes through it along with the vein. So these are the structures which is passing through the esophageal opening of the diaphragm. Moving on to the next, that is if we move on to the next, that is the aortic hiatus at the level of T12. The structures passing through it is the aortic hiatus. The structure passing is aorta. From here the thoracic aorta changes its name to abdominal aorta. Azygous and hemiazygous vein, thoracic duct, lymphatic vessels and aortic plexus are passing through the aortic opening. Now, if we talk about the minor openings and the structures passing through the respective cruras of the diaphragm are greater and the lesser splanchnic nerve and the least splanchnic nerves, azygous and hemiazygous with at times, but mainly the greater and lesser splanchnic nerves and the least splanchnic nerve for the respective cruras of the diaphragm, through the respective cruras of the diaphragm. So, is it okay? So, in short, if you will see this schematic diagram, you can revise all the major and few minor openings of the diaphragm through which important structures are passing. So, got it? Let's move on to the next, that is question number 9. Okay. Thoracic duct receives tributaries from all of the following except. Thoracic duct receives tributaries from all of the following except. The options are A. Bilateral ascending lumbar trunk, bilateral descending thoracic trunk, left upper intercostal duct, right broncho mediastinal lymphatic trunk. So, 4 options are there, my dear aspirants. 30 seconds will be provided to you. Which of the following is not a tributary of thoracic duct? Is not a tributary of thoracic duct. Your time starts now. Mark the correct answer, my dear aspirants. Your time starts now. Question number 9. So, yes, I got an answer from Tejashri and she is absolutely right. Right bronchopulmonary segment. Yes, the correct answer is right bronchopulmonary segment. Yes, absolutely right. Right bronchomediastinal lymph trunk. Sorry, right bronchomediastinal lymph trunk is absolutely right answer. The reason is that if we are talking about right bronchomediastinal lymph trunk, it drains into right lymphatic duct. It is draining lymphatics from right bronchomediastinal lymphatic trunk drains into right lymphatic duct. It drains into right lymphatic duct, not into thoracic duct, not into thoracic duct. Rest all, that is bilateral ascending lymph trunk, bilateral descending thoracic trunk, upper intercostal duct, left side will all drains into thoracic duct. My dear aspirants, I would like to quickly write down the tributaries of thoracic duct, because tributaries of thoracic duct has been asked in previous year. So, it is important that you should know the details. So, please write down the details, everyone. Write on the heading. Okay, so please write on the heading. The heading is tributaries of thoracic duct. Okay, so the tributaries of thoracic duct is following. Please write down. The tributaries are bilateral, right and the left descending thoracic lymph trunk. Right and the left descending lymph trunk. Got it? Okay. So bilateral right and the left descending thoracic lymph trunk, it is draining lymphatics from which spaces? So it is draining the lymphatics from lower 6 to 11 intercostal space. Now coming to the second, also right and the left upper intercostal lymph trunk. So when I am using the word upper intercostal lymph trunk, it means it is conveying lymphatics, lymph from the upper intercostal spaces, upper 1, 2, 3, 4, 5 intercostal spaces. So it is draining lymph, it is conveys lymph from upper intercostal spaces. Which spaces? 1 to 5. 1 to 5. It is okay? So we got the important tributaries of thoracic duct. Other than that, the other tributaries of thoracic duct is also important for you to know. So also the tributaries of lymphatic ducts, lymphatic trunk, right thoracic. So we have already seen in the MCQ that right bronchomediastinal lymph trunk was draining into right lymphatic duct. But when we are talking about the other one, actually the question was of thoracic duct, and major chunk of the lymphatics is draining into thoracic duct. So the other drainage will be mediastinal lymph trunk, the left subclavian lymph trunk, the left jugular lymph trunk, and that of left bronchomediastinal lymph trunk. But not the right one, bronchomediastinal. So please note down, these are important tributaries of the thoracic duct, but not the right bronchomediastinal lymph trunk. So got it? So we have got D as the correct answer for this. Let's move on to the next. So before that, you can see this image of the thoracic duct, where you can see it start forming by the upper end of the cisterna chyli. At the level of T12, it is descending. As you can see, it is exactly running between the azygous vein and that of descending thoracic aorta, and exactly at the level of T5, it is slightly changing its direction towards the left hand side, and it is moving slightly left hand side, and at the level of C7, it is draining at the junction of left jugular vein and left subclavian vein. So at the junction of left jugular vein and left subclavian vein, it is draining. Okay, so this is all about in short about the thoracic duct. Let's move on to the next, and that is question number 10th. Left superior intercostal vein drains into. So your time starts now. Mark the correct answer. Left superior intercostal vein drains into azygous vein, hemiazygous vein, brachiocephalic vein, internal thoracic vein. According to you, which is the correct answer? Question number 10th. Your time starts now. Mark the correct answer. Left superior intercostal vein will drain into. The correct answer is brachiocephalic vein. Actually, when we are talking about posterior intercostal vein, it is different on the right hand side and the left hand side. So it is important. Yeah, Tejashri is absolutely right. C is the correct answer. Agar hum right side ka, if we are talking about left superior intercostal vein, when the question is about left superior intercostal vein, it is draining into brachiocephalic vein. Okay, but if the question was about right superior intercostal vein, so that is draining into azygous vein, then the correct answer will be azygous vein. So at that point, the correct answer will be azygous vein. Okay. The correct answer will be azygous vein. Now, my dear aspirants, please just enlarge this image and then you can see the correct explanation here. So, what you can see when we are talking about azygous and that of the azygous vein and that of hemiazygous and accessory hemiazygous, let's talk about firstly the drainage of posterior intercostal vein on the right hand side and left hand side. So, in this diagram, first thing is the right posterior intercostal vein is called as right सुप्रीम इंटरकॉस्टल वेन. उसी तरह यहाँ पे लेफ्ट सुप्रीम इंटरकॉस्टल वेन है, दैट इज द लेफ्ट पोस्टीरियर इंटरकॉस्टल वेन, द फर्स्ट वन. बोथ द साइड दे आर ड्रेनिंग इनटू रेस्पेक्टिव. सो बोथ द साइड, व्हाट यू कैन से, बोथ द साइड, अगर हम बोथ द साइड की बात करें, द राइट साइड एंड द लेफ्ट साइड, द फर्स्ट posterior intercostal vein, first posterior intercostal veins are draining into respective brachiocephalic vein. Respective brachiocephalic vein. So that is quite clear with this image also. Okay. Now the MCQ was about superior intercostal vein. Actually superior intercostal vein, when we are talking about superior intercostal vein, अगर हम superior intercostal vein की बात करें तो right side में superior intercostal vein is formed by joining second, third and fourth right posterior intercostal vein, and left posterior intercostal vein will form the left superior intercostal vein. So see here, this is left superior intercostal vein and this is right superior intercostal vein, and superior intercostal veins are formed by joining second and third right and the left corresponding posterior intercostal vein. So in the right side it is draining into azygous vein, in the left hand side it is draining again into brachiocephalic vein. ठीक है. अभी now 5th, 6th, 7th, 8th, 9th and 10th posterior intercostal vein of right side will drain into azygous vein. So these all are again draining into which vein? Azygous vein, again draining into azygous vein. So 5th, 6th, 7th, 8th, 9th, 11th, as you can see all these veins again. So see here, if I will use this, so see here. So we have done with this. Now see here, if we are talking about 5th, 6th, 7th, 8th, 9th posterior, right posterior intercostal vein, they are draining into azygous vein. So you can see right superior intercostal vein and that of right posterior intercostal vein all are draining on right hand side to the azygous vein. But left hand side में 5th, 6th, 7th and 8th left posterior intercostal vein is draining into which vein? Accessory hemiazygous. It is draining into accessory hemiazygous. See here. And if we see the hemiazygous, the 9th, 10th and 11th posterior, left posterior intercostal vein will be draining into hemiazygous in the left hand side. See here. Also subcostal is draining into hemiazygous in left hand side, and 12th is the right subcostal draining into azygous. Actually this common image and the diagram is giving you the drainage of all the posterior intercostal vein. So is it clear? Please let me know. Rishi and Tejashri, everyone, as the concept of the drainage of posterior intercostal vein clear on right and left hand side, please let me know so that I can proceed to the next MCQ. Is it okay? Is it okay? Can we proceed to next MCQ? 11th number MCQ is the concept of posterior intercostal vein drainage of all the posterior. How many posterior intercostal veins are there? 11 posterior intercostal veins are there, and we have discussed all the drainage. So let's move on to the next one. If any doubt and if you want to repeat, okay, Tejashri, it's okay. So let's move on to the 11th one. Anterior posterior intercostal arteries passes between. Anterior and posterior intercostal arteries are passing between which of the following layers? So 5 options are there: skin and external intercostal muscle, external and internal intercostal muscle, internal and innermost intercostal muscle, innermost and transversalis fascia and peritoneum. Okay, Tejashri, so all of you can mark the question number 11th for me. Which is the correct answer according to you? Please mark the correct answer, my dear aspirants. Okay, I got an answer as 11. C, intercostal, okay, internal and innermost intercostal muscle. Absolutely correct. C is absolutely correct. C option is absolutely correct. Actually, if we talk about the nerves vein and artery traversing neurovascular bundle. If we talk about neurovascular bundle passing between which two intercostal muscle, so the correct plane will be the middle and the innermost layer. So actually when we see the arrangement of intercostal muscle in layers, the outermost layer is external intercostal muscle, underlying it is internal intercostal muscle, or सबसे deeper aspect में innermost intercostal muscle. So the artery, vein and nerves which is traversing here is traversing between the innermost and that of intermediate intercostal muscle. So C is the correct answer. So absolutely correct is the C answer. Now see here, this is the diagram where you can see the corresponding ribs. Okay, so this is the upper rib, you can say this is the upper rib. Okay, this is the rib above and this is the rib below, no doubt about this, and the intercostal muscles are running between rib above and the rib below. Okay, so if we go layer wise, the most outermost muscle will be external intercostal muscle, then is the internal intercostal muscle, and then is the innermost intercostal muscle. So this is the three layers of the muscle, as you can see. Outermost is external, and then is internal, and then is innermost intercostal muscle, which is quite clear in this diagram. Okay, now so see here, this is the external one. Just opposite to the direction of the fibers of external is the direction of fibers of internal and innermost. Now see here, if you will see the flap of the muscle, that is the intermediate and that of the innermost layer of the muscle, exactly in between the internal intercostal and innermost intercostal muscle, we have got vein, artery and nerve traversing. So if you will see the location of this vein, artery and nerve, exactly you can memorize with the mnemonic VAN. So the structures passing between the intercostal muscle, intermediate and innermost, and the order of vein, artery and nerve passing is VAN. The superiormost structure is V for vein, then is the artery and then is the nerve. So सबसे ऊपर क्या होगा? Intercostal vein, then is intercostal artery, and the lowermost is intercostal nerve. Got it everyone? Let's move on to the next, that is question number 12. Okay, which of the following structure may compress the esophagus? Which of the following structure can be an important site for the compression of esophagus? The options are sorry, aortic arch, right main bronchus, left vagus, right brachiocephalic vein, or brachiocephalic trunk. 5 options are there. Mark the correct answer, my dear aspirants. Your time starts now. Question number 12. Okay, A and B, I am getting A also, I am getting B also. Okay, I am getting A and B. Actually, my dear aspirants, the correct answer is A, aortic arch. It's not the right main bronchus, it will be the left main bronchus which will be compressing the esophagus. So in case of esophagus, if we talk about, there is 4 site of constriction in the case of esophagus. That is the aortic arch, left principal bronchus, cricopharyngeal, that is pharyngoesophageal junction, and that of esophageal opening of the diaphragm. So 4 openings or constriction level is there. I would like to show you this diagram. So see here in this diagram, what you can see, the first level of constriction is pharynx and esophageal. So the first level of constriction is pharyngoesophageal junction. Pharyngoesophageal junction is the first level of constriction. The second constriction is the level of arch of aorta. The third constriction level is left principal bronchus. The fourth level of constriction is esophageal opening of diaphragm. See here. So my dear aspirants, अगर मैं इसको vertebral level में बताऊँ, esophageal opening of diaphragm. So if I talk about in terms of vertebral level, so the vertebral level में pharyngoesophageal junction C6 level, arch of aorta T4 level, left principal bronchus T6 level, esophageal opening of diaphragm T10 level. Is it okay? Sorry. Okay. So these are the 4 levels of constrictions. These are the 4 levels of constrictions in case of esophagus. Let's move on to the next MCQ, that is MCQ number 30. Okay. Thymus is supplied by, what is the arterial supply of thymus? 5 options are there. Anterior intercostal branch of internal thoracic artery, brachiocephalic artery, posterior intercostal artery, left common carotid artery, pericardiophrenic artery. Question number 30. Which is the correct answer? Thymus is supplied by which of the following arteries? So your time starts now. Mark the correct answer. Okay. Question number 13. Mark the correct answer. Okay, I am getting B as the correct answer. Okay. What about others? What about others? So let me write about the blood supply of thymus. Actually, the correct answer will be A, that is actually thymus is getting blood supply by the branches of internal thoracic artery. A is the correct answer, that is anterior intercostal branches of internal thoracic artery. So A is perfectly correct answer. So all of you please write down blood supply of thymus. Yes, Subhadeep, absolutely correct dear. So write down the details of blood supply of thymus gland. Blood supply of thymus gland. So it's by internal thoracic artery. Major blood supply is by internal thoracic artery, and we know that internal thoracic artery is giving branches as anterior intercostal artery. So A was the correct answer. As well as by superior and inferior thyroid artery. Superior thyroid artery and inferior thyroid artery. Now, this was about the arterial supply. Now let's talk about the venous drainage. So this was about arterial supply. Let's talk about the venous drainage. So if we talk about the venous drainage, important venous blood drains into left innominate vein and also into superior thyroid vein, middle thyroid vein, and that of inferior thyroid vein. Okay. So this is all about, this is about venous drainage by innominate vein and all the 3 thyroid veins, that is superior, inferior and middle thyroid vein, and this is about the arterial supply. Arterial supply is by the branches of internal thoracic artery, anterior intercostal arteries and superior and inferior thyroid artery. So all of you please note down about the blood supply of thymus gland. Let's move on to the next MCQ. Okay, is it okay? Can we move on to the next MCQ? MCQ number 14. All the best my dear aspirants. Okay, before that I would like to show you this diagram where you can clearly see the outline of the thyroid gland. This is the thymus gland, sorry, outline of the thymus gland. We were talking about thymus gland, sorry. So the outline of the thymus gland, let me just highlight the thymus gland. This is the thymus gland which is shown to you. Okay. Now its a major supply of blood supply is by internal is by the right and the left internal thoracic artery, by the branches of internal thoracic artery. So internal thoracic artery branches is giving blood supply to thymus gland. Let's move on to the next, that is question number 14. Superior most structure in the hilum of the right lung. Which of the following structure is the superior most structure in the hilum of right lung? Whether it is eparterial bronchus, hyparterial bronchus, pulmonary artery or pulmonary vein. Which is the correct answer? So my dear aspirants, the time starts now. Please mark the correct answer. Superior most structure in the hilum of the right lung. Question number 14. Okay, so I am getting answers. The answers are coming up. Please mark the correct answer. So yes, eparterial bronchus is absolutely right. Actually, when we see the arrangement of hilar structure in the right and the left hand side, it is varying. The reason is that why it varies on right and left hand side is that the principal bronchus will divide into eparterial bronchus and hyparterial bronchus in case of right lung, hilum. But in case of left hand side, we have got just one principal bronchus. So this is the reason the relation varies. So let me just write the arrangement of structure from above to down in the right and the left hilum, and then I will proceed with the literature part. So don't worry. So firstly, see here, I want to show you the right lung hilum area and that of the left lung hilum area. So here the bronchus which you are, so you can see here, this is the bronchus and this is exactly the principal bronchus. This is exactly, you can say, the principal bronchus, it is exactly the eparterial bronchus, and one more bronchus is there, that is the hyparterial bronchus. So ये eparterial bronchus है और ये hyparterial bronchus है. In between the structures which is seen here is the pulmonary artery, and also lower down we have got the pulmonary vein. So actually inferior pulmonary veins. Here क्या होता है, सबसे ऊपर में जो structure right रहता है वो है आपका pulmonary artery, then is the bronchus, then we have got the bronchus, and then we have got the pulmonary veins. So don't worry, I will write this also. So what the major point which has to be noted in this diagram is that there are two bronchus in the case of right side and there is one bronchus in case of left hand side. Okay, so please write down the relation of the structure. So write down. In case of here, I just want to write right lung and the left lung. Okay, so right lung and the left lung structure in the hilum. So here from above to down, what will from above to down? So we are going with the from above to down, the relation of the structures as we move from above to down. So write down. In the right hand side, the most superior structure is arterial bronchus. Then is the pulmonary artery. Then is the hyparterial bronchus. And the inferior most structure is inferior pulmonary vein. Now from top to bottom the structures are, in left lung the important structure superior most is the pulmonary artery. Then is the principal bronchus, okay. And what is the inferior most structure? Inferior pulmonary vein. So on both the side, inferior pulmonary vein is the inferior most structure. Got it everyone? So is it okay? The relation of structures from on right hand and left hand side has been compared. So the relation of the hilar structures on the right hand side is compared with the left hand side from top to bottom. Okay, so let's move on to the next. So let's move on to the next MCQ, that is MCQ number 15. All the best my dear aspirants, all the best. 15th number MCQ. Which of the following is not supplying the marked area of the heart? So can you see the arrow marked area has been shown to you, and you have to identify that area or the chamber of the heart firstly, and then you have to tell me which of the following structure of arteries is not giving any kind of blood supply to this marked area. So your time starts now. Mark the correct answer. Whether it is right coronary artery, anterior interventricular artery, marginal artery or diagonal artery. So your time starts now. Mark the correct answer. Question number 15. Question number 15. Yeah. Okay, so yes, mixed bundle of answers are coming up. A भी आ रहा है, B भी आ रहा है. What is the correct one? Let me come up with the explanation. Question number 15, mark the correct answer. So my dear aspirants, actually the correct answer is diagonal artery. So please, so can anybody tell me which chamber of the heart is this? This arrow marked area is which chamber of the heart? So which chamber of the heart? Any guesses? Which chamber of the heart is it? So if I just highlight this diagram, so you have to just identify this area of the chamber of the heart. So this is exactly right ventricle. This chamber of the heart is right ventricle. Why? As you can see, yes, absolutely right. Can you see this is the pulmonary trunk? Okay, this is the part of pulmonary trunk. So this is PT, pulmonary trunk, which is again divided into right and the left pulmonary arteries. Okay, pulmonary artery. So this is right ventricle, absolutely right. So this chamber of the heart is right ventricle. So actually right coronary artery is definitely providing blood supply to the right chamber of the heart. Anterior interventricular arteries, actually anterior interventricular artery is a branch of left coronary artery, but it is also providing blood supply to the right chamber of the heart, right ventricle. It is also giving blood supply to right ventricle. Marginal artery, branch of right coronary artery, is also giving blood supply to the right ventricle. So all A, B, C, so the source of A, B and C, all these arteries are giving blood supply to right ventricle chamber of the heart, but not the diagonal artery. Diagonal artery is a branch of left coronary artery and it is giving blood supply to left ventricle. It is not giving any kind of blood supply to the right ventricle. So we have got diagonal artery as the correct answer. So this is the reason we have got diagonal artery as the correct answer. So this is the reason we will go with diagonal artery as the correct answer. LAD, LAD, LAD is also a branch of left coronary artery, left anterior descending. So anterior interventricular artery is also called as LAD artery. Anterior interventricular artery is also called as LAD artery, that is left anterior descending, and it is a branch of left coronary artery. Left coronary artery. It is also giving blood supply to right ventricle. So only diagonal artery is not giving blood supply to that of right ventricle. This was asked in 2019 AIIMS entrance examination. So see here, now you can see here that this is the right coronary artery. Important branches of right coronary artery is posterior descending artery, right marginal artery. Actually posterior descending artery is also called as posterior interventricular artery. It is also called as posterior interventricular artery, and they are basically supplying the area of right ventricle, right arterial chamber. Now left coronary artery, two important branches are there, left marginal, left circumflex. Actually LAD artery, which is also called as left anterior descending. So here you can see this is the LAD artery, which is also called as anterior interventricular artery. These are all branches left coronary artery, but they also provide certain blood supply to right arterial chamber. But when we are talking about diagonal artery, when we are talking about diagonal artery, which is a branch from left coronary artery, it is not giving any, not supplying right ventricle. It is not giving any supply. So it is basically supplying which ventricle? Diagonal artery is giving blood supply to left ventricle, not right ventricle. So is it okay everyone? By seeing this diagram, your concepts must be clear. Everyone, is it okay? So okay, can we move on to the next MCQ, that is MCQ number 16. Okay, so let's move on to 16th number MCQ. Okay. Bronchi are lined with pseudostratified epithelium. Bronchi are lined by pseudostratified epithelium. As the airways continue distally, the epithelium changes. Which of the following feature is last to disappear as the epithelium changes along the respiratory tube? Cilia, goblet cells, mucous gland or cartilage? Which of the following structure is last to change? Okay, we know that the lining epithelium of bronchi is similar to respiratory epithelium, but after that when we go more distally, abhi kya hota hai, pulmonary trunk divides into principal bronchus, bronchus into secondary, tertiary, respiratory bronchus, alveolar duct, alveoli, like this. So there is junction of the respiratory and conducting part also. So there are certain changes which is going on. So you just tell me which of the following structure is last to change. Your time starts now. Please mark the correct answer. Cilia. So I am getting an answer as cilia. So yes, cilia is absolutely correct answer. So cilia is absolutely correct answer, my dear aspirant. Cilia is absolutely correct answer. Cilia is absolutely correct answer. Yes, cilia is the last to change. Bronchi, lining epithelium, pseudostratified ciliated columnar epithelium, and the last, actually when we go more distally, there is changes of cartilage goes, the goblet cells disappears, mucous gland disappears. But if we have to see the changes which is appearing, which is getting changed the last, we will go with cilia as the correct answer. See here. By the terminal bronchioles, the airway epithelium has changed from pseudostratified ciliated columnar to ciliated simple cuboidal. So see here, at the level of terminal bronchioles, the epithelium is changing. We know that the epithelium, respiratory epithelium, is pseudostratified ciliated columnar. It will change to simple cuboidal, and thereafter subsequently change होता है, and at the level of alveoli it becomes, जब हम alveoli lining की बात करेंगे, alveoli lining की बात करेंगे, it is simple squamous epithelium. It becomes simple squamous epithelium. So epithelium is decreasing in height. Okay, cilia are present throughout the respiratory bronchiole, but it is not present in alveolar duct and alveoli. So my dear aspirants, it is not present in alveolar duct and alveoli, but it is present in respiratory bronchiole. That means this is the last structure to change. That means this is the last structure to be changed. Absolutely right. Cilia are present throughout. So actually, yes, Subhadeep, it is present in terminal bronchioles, and also few of cilia are present in respiratory bronchioles also. Subhadeep, few cilia are also present in respiratory bronchioles. So the arrangement of the important function of cilia is to protect and propel the mucus towards the pharynx. We are not, we want to mucus to be expelled out. Okay, so cilia is protecting the respiratory trunk from the mucus being expelled out. The presence of cilia beyond most distal mucus producing cells. Okay, the presence of cilia beyond most distal mucus producing cells, and just before what happens, so it is presenting more distally at the level of terminal bronchioles, and few are also present in respiratory bronchioles. So this is the last structure to vanish. Okay, now let's talk about the other option B, that is the mucus accumulation. So here prevents. So bronchial mucus is disappearance is occurring much more earlier than that of the cilia. When we talk about submucosal mucus and serous glands which is traversing and cartilaginous plates, so we know that cartilaginous plates are fragmented in case of principal bronchus, and it terminates in the smaller bronchioles. So bronchioles are not containing. So when we are talking about the bronchioles, they are containing no glands, they are containing no goblet cells, they are containing no cartilage, but they are containing cilia. But presence of cilia are there. Presence of cilia are there in quite a large number. Till respiratory bronchioles, few are there, and few bronchioles, few are present, and so few are more of cilia are present in the case of terminal bronchioles. Okay. Okay. Few cilia are there. Okay, don't worry. No, cilia, Subhadeep, few cilia are also present in the respiratory bronchioles also. Okay. Okay. Yes, Subhadeep, please note down. Yes, you can say large number are present and are present in terminally bronchioles, but few cilia are also present in respiratory bronchioles. Okay. Let's move on to the next, that is question number 17. True about internal thoracic artery. Okay, Subhadeep. Okay. True about internal thoracic artery. True statement about internal thoracic artery arises from the first part of subclavian artery. Pericardiophrenic is the terminal branch, divides in the fourth intercostal space, descends at the posterior end of intercostal space. Question number 17, mark the correct answer. True statement about internal thoracic artery. So the most correct statement about internal thoracic artery, oh, I got an answer from Tejashree. It's A, arises from the first part of subclavian artery. So actually first part of subclavian artery, first part, important branches are, it gives 3 important branches from the first part. That is thyrocervical trunk, it gives thyrocervical trunk, it gives internal thoracic artery, it gives vertebral artery. So these are the 3 branches from the first part. From the second part, costocervical trunk and dorsal scapular from the third part. So these are the branches from the first part of subclavian artery. अगर हम second part की branch बात करेंगे, second part of subclavian artery, important branches, costocervical trunk, and third part से कौन सी branch है? Dorsal scapular artery. Actually this was not the MCQ, but it came in my mind, so I am writing it, don't worry. So branch from the third part of subclavian artery, and subclavian artery is divided into 3 parts by which muscle? Scalenus anterior muscle. Pericardio is the terminal branch, is absolutely wrong. Which is the terminal branch? Which 2 branches are terminal branch? Musculophrenic artery and that of superior epigastric artery. Terminates in 4th intercostal space? No, it terminates in 6th intercostal space. Descends on anterior end, it descends on anterior end of intercostal space, not the posterior end. So write all these. So see here, this is the subclavian artery, which where you can clearly see that in case of subclavian artery, it is a, so we can see that internal thoracic artery is a branch of subclavian artery. The important branches are pericardiophrenix, perforating branches, anterior intercostal artery, and at the level of 6th intercostal space, it is giving 2 terminal branches, and the 2 terminal branches of internal thoracic artery is musculophrenic artery and superior epigastric artery. So these 2 arteries, that is the superior epigastric artery and that of musculophrenic artery, these are the 2 terminal branches of internal thoracic artery. These are the 2 terminal branches of internal thoracic artery. Now my dear aspirants, also please note down anterior intercostal arteries in the till 6th. So 1 to 6th, 1st to 6th anterior intercostal arteries are the branch of ITA, internal thoracic artery, but 7th, 8th and 9th are the branches. 7th, 8th and 9th anterior intercostal arteries are the branch of, as shown in the diagram, they are the branch of anterior intercostal artery, they are the branches of musculophrenic artery. They are branches of musculophrenic artery. Got it everyone? So yes. So can we move on to the next MCQ, MCQ number 18. Is it okay? So let's move on to 18th number MCQ. Is it okay, Subhadeep? Everyone? Tejashri? Let's move on to 18th number MCQ. Blood supply of diaphragm is through all except, blood supply of diaphragm is through all of the following except, options are middle phrenic artery, inferior phrenic artery, musculophrenic artery, pericardiophrenix artery. Blood supply of diaphragm is through all of the following sources except which of the following is the correct answer, which is not giving any kind of blood supply to diaphragm? Subhadeep, absolutely right. Middle phrenic artery is not providing any kind of arterial supply or blood supply to diaphragm. Rest all arteries is providing blood supply to diaphragm. So quickly write the blood supply of diaphragm. So quickly write arterial supply of diaphragm. So actually the arterial supply of diaphragm is by following sources. So they are, first is superior phrenic artery, So superior phrenic artery, can anybody give me the answer, is a branch of which artery? Superior phrenic artery is a branch of thoracic, descending thoracic aorta. It's a branch from DTA, descending thoracic aorta. Now musculophrenic artery, also from pericardiophrenix artery. So musculophrenic artery and pericardiophrenix artery, just now we have seen it is a branch of, these two are a branch of ITA. What is ITA? ITA means internal thoracic artery. Now coming to the fourth source of arterial supply is via inferior phrenic artery. And can anybody tell me inferior phrenic artery is a branch of which artery? Inferior phrenic artery is a branch of abdominal aorta. It is the first branch of abdominal aorta. Inferior phrenic artery. Yeah, absolutely right, Subhadeep, absolutely right. So we have got the answer that superior phrenic artery, musculophrenic artery, pericardiophrenic artery and inferior phrenic artery are the major source of blood supply to diaphragm, and middle phrenic artery is not providing any kind of blood supply to diaphragm. So we have got A as the correct answer. So let's move on to the next, that is question number 19. Bronchopulmonary segment in right and the left lungs are respectively, bronchopulmonary segment in right and the left lung is respectively, according to you, which is the best answer, whether it is 9 and 11, 11 and 9, 10 and 8, 8 or 10. Yes, so your time starts now, mark the correct answer. Bronchopulmonary segment in right and the left lung are respectively, according to you, which option is the best answer? Question number 19. Subhadeep has given his answer. So as a total of BPS, bronchopulmonary segment for right and left. So actually most of the time it is 10 bronchopulmonary segment for right hand side and 10 bronchopulmonary segment for left hand side. But a variation occurs and at times there can be 8 bronchopulmonary segment in the left lung. Normally 10 bronchopulmonary segment BPS in the right lung and that of left lung. But sometimes variation occurs and there can be 8 bronchopulmonary segment in left lung and there will be always 10 bronchopulmonary segment in the right lung. So we have got C as the correct answer. Now what happens? How this? Yes, Subham is absolutely right. Now how this change happens? So which bronchopulmonary segment is absent or merged together? So that is important for you to know. We know that right bronchus, right principal bronchus is dividing into 3 lobar bronchus, that is upper, middle and lower. Okay. So normal case में क्या होता है? So let me explain this, then I will come up with the explanation. So in normal case what happens? Right principal bronchus divides into 3 lobar bronchi and that is upper, middle and lower, and we get total of 10 bronchopulmonary segment, in right hand side. But left hand side में क्या होता है? Left principal bronchus in left hand side will divide into 2 secondary bronchi actually, and after that what happens? It will divide normally in 10 bronchopulmonary segment most of the time, but at times there is certain changes which is seen, and I would like to mark that changes. What happens? So the certain changes occurs is often what happens in the left hand lung, the medial basal segment is absent. So often there will be medial basal segment absent in case of lower lobe of left of left lung. Okay, left side. So तब क्या होगा? Total क्या हो जाएगा? 9 bronchopulmonary segment. So this can be one case. Other case can be either the medial basal lower lobe of left hand side में medial basal segment is absent. Otherwise क्या होगा? Anterior और medial basal segment merge together. Otherwise there is merging of anterior plus the medial basal segment. In case of left lower lung, in the case of left lower lobe of the left hand side. So this will lead to formation of anteromedial basal segment, anteromedial basal bronchopulmonary segment. So this is the case. अभी क्या हुआ? अभी हमें क्या मिला? 9 bronchopulmonary segment. लेकिन at times मैंने क्या बोला है 8 bronchopulmonary segment also. So that means there will be certain changes in the upper lobe of bronchopulmonary segment also, and that change will be that apical and the posterior bronchopulmonary segment, apical and the posterior bronchopulmonary segment of the left upper lobe of the left lung will fuse together to form apico-posterior bronchopulmonary segment, will form apico-posterior bronchopulmonary segment. So in this case कितना होगा, total 8 bronchopulmonary segment होगा. So the important changes which I want to, either medial basal bronchopulmonary segment is absent or anterior medial basal bronchopulmonary segment is merged in the left lower lobe, or sometimes apical and posterior bronchopulmonary segment merge in the left upper lobe. So that would lead to take place 8 bronchopulmonary segments. So that means variation of bronchopulmonary segment is more evident in the left hand side as compared to right hand side. So is it okay everyone? Any more explanation? Is it okay Subham, Tejashri, Subhadeep? So please note down. Certain changes which take place in the left side is anterior medial basal bronchopulmonary segment merges to form a combined antero-medial basal bronchopulmonary segment in the left lower lobe, or left upper lobe में apico-posterior bronchopulmonary segment merges. Now, other than that, if you will see this diagram, okay, so if you see this diagram, you can get a layout of right and the left lung bronchopulmonary segments. This is the diagram, and you can see here there is superior. In the right lung, there is superior, middle and the inferior lobe, and there is respective 10 bronchopulmonary segment in the right lung, and same way there is 10 bronchopulmonary segment, 5 in upper and 5 in the inferior lobe. So total of there is 10, and at times there is merging of apico-posterior has been shown here. Apico-posterior, there is merging of apico-posterior which has been shown here. Let me mark this, and the other merging is the antero-medial basal. See here, is it okay? So that table is also there, you can see the table and the diagram also. So let's move on to the next. That is question number 20th. So your time starts now. Let's mark the correct answer. So before that, let me read it for you. Which of the following do not elevate the ribs? Which of the following rib is not elevating the ribs? Okay, so elevation of ribs takes place in which of the phenomena? Inspiration. तो आपको क्या मार्क करना है? Expiratory muscle. Okay, serratus posterior superior, serratus posterior inferior, external intercostals, levator costarum. So which is the correct one? Which of the following do not elevate the ribs? 4 options are there. Mark the correct answer. Question number 20th. So you have to just know the muscle of expiration in this whole list. Question number 20th. Subhadeep has given the answer. What about others? Question number 20th. So actually the correct answer is B, serratus posterior inferior. So this is the expiratory muscle. So in the expiration there is depression of the rib, and these are all inspiratory muscle. They are all the muscles which is active in inspiration. So in inspiration what happens? There is elevation of the rib. So we have got B as the correct answer. My dear aspirants, I would just like to give you a mnemonic how you are going to identify the muscles which is elevating. So you have to know the list of the muscle. So just memorize this that muscles causing expiration, or you can say muscle causing elevation of the ribs. Okay, elevation नहीं, यहाँ पे क्या होगा? Expiration है तो depression of the ribs. Depression of ribs. So actually there is a mnemonic for it, and the mnemonic is SIT. SIT Q depressor. SIT Q depressor means these muscles are depressors of the ribs. Okay. So here S stands for S, I, T and Q. So let me write. S stands for serratus posterior inferior muscle, serratus posterior inferior muscle. I stands for internal intercostal muscle. I stands for internal intercostal muscle. T stands for transverse thoracic muscle. T stands for transverse thoracic muscle. And what does the Q stands for? Q stands for quadratus lumborum muscle. Q stands for quadratus lumborum muscle. So see here, these are all the list of the muscles, these are all list of the muscles which is causing the depression of the ribs. So is it okay? These all muscles are causing depression of the ribs and the list is sit Q depressor. Okay, depression. These are the muscles which is active in expiration. So we have got B as the correct answer. Okay, my dear aspirants. Okay, so before ending the session, few important points which I want you to tell that please note down here. One important point is I am going to take the session on 26th of Jan. The timing will be 1 p.m. and 3 p.m. So I would like to take a session on exactly 1 p.m. and that of 3 p.m. So I will update about, so tomorrow is 26th, tomorrow is your Wednesday. So please note down, tomorrow is Wednesday. So on Wednesday, I am going to take a session on 26th January. So tomorrow 2 special classes. Okay, my dear aspirants, tomorrow will be 2 special classes in the afternoon. So you can enroll in the special class by using the code NAT10. So high yield anatomy MCQs 26th. Please note down, it is 26th on Wednesday, tomorrow afternoon session. Okay, okay dear NEET PG aspirants. So okay, all those who are interested for the free session, do download the Unacademy app, find their goal as NEET PG and then you can search for Dr.Monalisa free session tomorrow Wednesday 26th January free session. Timing is the afternoon 1 p.m. 3 p.m. session. Now this is the free test calendar for the entire month. So see here, this is the free test calendar. So you can pause this and you can see the details of what are the topics which is going to be taken in this free test calendar of Unacademy. Do enroll by using the code NAT10 and use the code NAT10 and do enroll for this session. This will be highly beneficial for you. Okay. So yes, now I would also like to tell you about the Republic Day special offer where 6 months of free extension is provided to you. Okay, 6 months of free is provided to you, that is starting from today. So 25th of January, 26th and 27th of January, you can take the subscription of 1 year and more, and the positive point is that you are getting an extension of free 6 months. This is a great offer. So just grab this opportunity, take the subscription, use the code NAT10 to get an extra discount of 10%. So this is a huge offer which can be availed by you. Yes Neha, all the best. Yes Neha Soni, these are all for the competitive exam for the MBBS students will give the specialized MD and MSK examination ke liye. Okay, these are highly useful for those who have already joined the MBBS course. Okay, so this is the great offer which is on these 3 days. You can avail this opportunity. Use my code to get an extra discount. So my dear aspirants, I will also like to show you this pricing detail where you can see the comparison has been done in the Plus and Iconic, and you can make a choice whether you want to go for Iconic or Plus course. The students of first and second years should definitely go for 3-4 years of subscription because their comprehensive course are right now going on the batches of Unacademy, and there you can have your prof examination cleared for the respective prof examination of your years along with your next preparation. Iconic preparation, definitely the aspirants who are preparing for NEET PG, FMG and INICT and next examination, so definitely go for Iconic subscription. Use the code NAT10 to get a extra discount of 10%, and this is the correct time to take the subscription. Extra 6 months is there. As I told you, this is the Republic Day offer. Okay my dear aspirants. Now, and once more I just want to remind you that tomorrow is Wednesday 26 January. Do present for my free session, afternoon session 1 p.m. and 3 p.m. high yield anatomy MCQ session. Tomorrow there will be high yield anatomy MCQ session. So do present for the afternoon session. That is the free special sessions, and all the best. Thank you. Do present for the session, And before ending the session, I also want to tell that when you are seeing the session on the Unacademy free platform, you can also download the PDF note. So you can also download the PDF note. That is the another great point about the Unacademy platform. So you can have this opportunity. So just grab this opportunity. So do like, subscribe and share. Let's crack NEET PG platform. All the best, my dear aspirants. So all the best. Let's meet in the next session. So now I am starting another session of General Anatomy MCQs. Those who are present, General Anatomy MCQs, that will be taking on the Unacademy Future Doctor platform. So those who are interested, they can join me live for the YouTube session. Unacademy Future Doctors. Let's start with the session. That is 5 PM में मैं start करूँगी after 25 minutes. All the best, students. All the best. Thank you.